Thank you all very much for coming. I'm Jenny Willott. I'm the Member of Parliament for Cardiff Central, which is not why I'm here today. I'm one of the Vice Chairs of the All-Party Parliamentary Group on HIV AIDS, which is why I'm interested in these issues. My background's in the voluntary sector. Before I got elected to Parliament, I used to work for UNICEF UK, so all the issues that we'll be talking about today are issues that I was working on when I was working for them. And I had a very eye-opening experience a couple of years ago when I volunteered as a Member of Parliament with VSO in Zambia, in Lusaka, working in a community-based organisation that worked with people who had TB, and they all had TB basically because they were all HIV positive.
I think amongst the findings that were most shocking in the report is that there is evidence that HIV is being used as a smokescreen, as an excuse to change the care landscape, with the orphan crisis, what's called an orphan crisis, being used as justification for the expansion of residential care, particularly true in some parts of sub-Saharan Africa. Residential care, particularly in that sort of large-scale, low-quality facilities seen in many parts of the world, and in Ukraine in particular, we've got lots of evidence for it, is very harmful to children. It's also expensive and drains resources away from HIV, especially HIV-positive children who don't currently have the same care options open to them as other children. They're more likely to lose parental care, not just because their parents are more likely to die, but also because of discrimination and challenges to gaining access to it. In the report, you'll see some really evocative, emotional quotes. An HIV-positive father in Malawi summed it up from a parent's perspective. He said, I don't know if they've got pictures of him coming up on the screen, but he said, "These are my children, they're my blood, they're God's gift to me, I love them. My disease should not separate me from the people I love the most." And a boy in India, living with his HIV-positive mother, told us, "I feel happy when I'm with my mum. Nobody will look after me like my mother." In all three countries, when children can't be with their parents because they both died, for example, their first choice of primary caregivers are their grandparents, and in particular grandmothers, and this confirms global findings. The programme manager in India summed it up. Grandparents are able to welcome HIV-affected children. They're worried about the child's care and love. Others don't care, they only worry about the disease.
We heard stories of mothers who were sending their children away to avoid them being rescued by the authorities, or to protect them from the risks of a brothel, but not being able to see them for many years after. They weren't being supported with childcare or parenting advice or access to services. They were being demonised and criminalised for trying to earn enough money to care for their children. In India, we had a sex worker who reported that she approached a clinic for PMTCT services to prevent the transmission of HIV from herself to her child, and was turned away on the basis that she was very complex, and we need to make sure that we recognise that diversity and understand that children want to be with their families and that they do best in their families when they're functioning well. And rather than writing off families, we need to make sure we're supporting all families to build their capacity to be better parents, to be better guardians, and to provide the ongoing care of children.
I would like to tell you about the story of Sergei, who is pictured in this slide as well. It is a 6-year-old boy who was abandoned by his young mother, who was a drug addict immediately after birth. All his childhood he spent in a specialized baby home, carrying a group number 1 sign. This was a special group for children born from HIV-positive parents. Staff segregated them for administrative reasons, like it was easier to manage antiretroviral therapy or more to play with them. But actually Sergei had nobody to play with because he was 6 years old and others were like 2 or 3 years old. And he stuck in a baby home and didn't enter school. Other residential home where he had to be moved after to start education had no medical staff to provide RT, and was afraid to have HIV-positive child in the institution.
Again, I just wanted to share with you the voice of one of the grandparents that we've been working with. This is Finn from Cambodia. She is 61.
and she cares for 4 orphan grandchildren. And she tells us, "There is a constant pressure to find money to support my grandchildren. Neighbours discriminating against us in the past would give me bad feelings. Other children would not play with my grandchildren. I was very, very sad when I lost my daughter and son-in-law. I wanted to die, and I felt helpless." And these are the types of messages that we hear a lot from the grandparents that we're with. So the report that EveryChild is launching today has shown us, has demonstrated the important contribution that grandparents are making. And we know that grandparents are willing to fulfil this role. But I think the third reality that we have to address is the fact that grandparents have really been insufficiently supported in this role.
Linda, Children's Investment Foundation. Thank you for a very insightful presentation. To what extent did the people you interviewed actually know their rights in terms of access to services?
Oksana, from your point of view.
Well, I will tell about our experience because in Ukraine it's very hard to find HIV positive people like openly speaking about their status. So we mostly rely on national network of HIV positive people. So to provide us access with the families.
Just kind of had come back through from Facebook. So somebody on Facebook has asked us to talk a bit about the MDGs and the focus on the MDGs and whether we think enough is being, whether the MDGs will really help a focus to create a focus around children, because as they currently don't mention them, through that HIV lens. So I think we know from an EveryChild perspective that that the MDGs themselves don't focus clearly enough on children, and that in particular children without parental care don't feature there at all. So they're very much an invisible.
So we're seeing an emphasis now on MDGs 4 and 5 on infant mortality and infant health and maternal mortality, and I think the HIV MDG maybe is in danger of being sort of dropped down a little, and I think it's really important that we keep the focus on the 3 MDGs together in their interrelatedness. And we know that women living with HIV are more likely to die during pregnancy and childbirth. We know that children born HIV positive are more likely to die before their 2nd birthday. We have the evidence of the relationship between them, so it's really important, I think, for us to keep that focus, and where perhaps some of the media attention or government responses are focusing more on those issues, we need to keep bringing HIV.
Just a couple of additional points as well. Obviously the fact that children are neglected within the MDGs has been raised from a HelpAge perspective. There's no mention anywhere of people aged 60 and over or 50 and over in relation to HIV in the MDGs. So that's another group whose needs are not at least explicitly being met by the MDGs. And just thinking again about the balance between prevention, treatment and care and support, the existing targets under the HIV MDG do not in any way address care and support.
Thank you everybody for coming along today, and thank you for everybody who will be listening in and watching in on the live stream and on Twitter. I hope we've managed to answer some of the questions, and there are many, many more. And I hope you'll all, if you have any other thoughts about this report or from your own organisational perspectives, things that you think would be useful to add in or ideas that we might want to take on board, please do get in touch with EveryChild as well, because we'd like to do more collaborative work on this. Thank you.